The Adult Children of Alcoholics and Dysfunctional Families Fellowship actually started out as an Alateen group. They were a group of individuals who were becoming adults, and they were looking around to find out where they would be able to go next, what fellowship or what 12-step program would help them in the way that they felt that they needed to be helped. And when they looked around, and they didn't really see anything available at the time. So they started the Hope for Adult Children of Alcoholics meeting, which again was really an Alateen meeting, and things just grew from there. This group of Alateens had a clear idea of what an adult child personality was like. They knew that they would respond to adult situations with self-doubt, self-blame, a sense of being wrong or inferior, and they knew that all of this was learned during their childhoods. They knew that whatever program they developed would have to work with those ineffective thoughts and judgments. They used the term adult child, and they used it to describe adults who grew up in alcoholic or dysfunctional homes, who exhibited certain identifiable traits that revealed their past abuse and neglect. And they called those traits, or that list of traits, that ineffective list of traits, they called it the problem. These common traits and behaviors were actually compiled into a list that's called the laundry list. Most adult children of alcoholics identify with these traits, and the laundry list, or the characteristics of an adult child, has become a foundational document in ACA meetings. These characteristics include being isolated and afraid of people and authority figures. They seek approval, and they lost their identity while doing that. They're frightened by angry people and any personal criticism. They became alcoholics, married them, or both. They live life from the viewpoint of victims. They have overdeveloped senses of responsibility. They feel guilty when they stand up for themselves instead of giving in to others. They became addicted to excitement. They confuse love and pity. They've stuffed their feelings from their traumatic childhoods and have lost the ability to feel or express feelings. They judge themselves harshly, and they have a very low sense of self-esteem. They're also dependent personalities who fear abandonment. They realize that alcoholism is a family disease and that they have become codependent. And they realize because they are codependents that they tend to be reactors rather than actors. Janet Geringer-Weititz was very active in ACA in the early years. She writes and lectures extensively on the topic of adult children of alcoholics. She also compiled a list that applies to both personal and occupational areas of an adult child's life, and includes such things as the fact that adult children sometimes guess at what normal behavior is, that they have difficulty following through on projects from beginning to end, and that they lie when it would be just as easy to tell the truth. She says that adult children of alcoholics have difficulty having fun, and they take themselves very seriously. She adds that children of alcoholics overreact to changes over which they have no control. She says that adult children of alcoholics usually feel that they are different from other people. And she agrees with adult children of alcoholics, the 12-step group laundry list. She agrees that children of alcoholics are super responsible, but she also adds that they can be super irresponsible as well. Adult children of alcoholics are extremely loyal even when it's undeserved. She said that, and she finishes her list by saying that adult children of alcoholics are impulsive. Adult children of alcoholics is committed to stopping the generational nature of family dysfunction. Adult children of alcoholics is similar to other 12-step groups, but their recovery work emphasizes the family system and the inner child or true self. What that means for adult children of alcoholics is that they're there to work on themselves, and they're going to examine their family systems by conducting what they call a blameless inventory of their parents to try to understand the generational nature of family dysfunction. They acknowledge the false self that emerged during their childhoods for protection in a dysfunctional system. They also acknowledge that they carry the false self forward into their adult worlds and it's not working for them. The ACA handbook states that ACA is the only 12-step group that embraces the difficult task of trauma work to find inner child or the true self. The ACA 12-step fellowship emphasizes the importance of sponsorship, both for the sponsor and the sponsee. However, ACA uses what they call a fellow traveler model of sponsorship. It's an adaptation of the AA model. ACAs, or adult children, have tendencies to look to others for direction and approval, or they have a tendency to try to run other people's lives. Knowing these characteristics made it difficult for the AA model to be applied. So what they did was they created this fellow traveler model, which really puts both the sponsor and the sponsee on equal footing. I thought it would be interesting to conclude with ACA's position on therapy and counseling. ACA recognizes that therapy with an informed counselor can enhance recovery. They recommend to their members that counseling is an addition to and not a replacement of focused step work with a sponsor. They believe that counseling can help ACA members become aware of dysfunctional family roles, and that counseling can help them understand the unspoken messages that are causing them to doubt themselves. They believe that informed therapist knows that most adult children operate from basic defenses that were learned as children. They also think that informed counselors should be aware that ACAs appear to be resilient or complex, but are really operating from a basic feeling of being defective. Informed counselors should also know that they need to address the false self and find the true self or inner child. They believe that informed counselors will understand the principles of the 12 steps and should also understand the sequence of recovery for adult children. Janet Geringer-Roytitz also makes some recommendations, and she recommends that adult children go to Al-Anon first because they are able to learn about the principles of 12-step programs and how to work the steps. She also believes that Al-Anon is a good place to start because they'll learn the Al-Anon principle of detachment first, and that this is important to do before joining an ACA support group. She also recommends qualities to look for in a therapist. And she said that the counselor should have an understanding of addictions, should have an understanding of self-help programs. The counselor needs to understand what it means to be an adult child of an alcoholic or what it's like to come from a dysfunctional family. And she says that counselors should also be willing to answer questions. Considering the statistics that I gave at the beginning of this video, it would not be unrealistic to believe that one day an adult child might ask for our help. We should be aware of the family backgrounds and characteristics of adult children. And we should also be able to recommend adult child 12-step groups or other adult child self-help groups.